All right, I think we can get started. Gave people a couple minutes after 9, and I'm sure we'll have people filtering in as we go. Um, so, Pete, I'll hand you the mic, and then I can just click as you need me.
Excellent idea. Thank you, Kayla. I
Mhm.
just started the recording and transcribing. I don't know what transcribing does, but it'll be interesting to see. It was just one button. So for those of you, be aware, you have to behave today because it's all recorded. Welcome to our second MOTS webinar, and it's February 1st, 2023. Time flies when you're having fun. We have a nice full agenda. We kindly request everybody who is not speaking to mute their mic. Just keep an eye on that because with all those microphones, sometimes it gets a little noisy here and there. Um, if you do have something to say or would like to ask a question or something is not clear, either you can use the chat or ask for the microphone or something like that. We'll have to work something out. This is still a bit of a new environment. The Teams environment is a little new for me. The go-to was default, everybody was muted, and then we had to use the text. So we can use the chat and we can use the microphone. I like to try new things, so hopefully that'll work. So, okay, let's take a look at the agenda today. And it's pretty full. We have 13 things. I think that's a record. Thanks, Kayla. I was kind of busy lately, still busy, but we have a nice looking agenda. We're going to talk about the team introductions. We thought to do something new, why we do these webinars. Most people know, of course, but it never hurts to pay a little attention to that. We have a news update. We have some MOTS updates. We have a little special about people having trouble logging in because that keeps coming. You lose your password or your ID or your user ID or something changes, and it always takes a little while before you are officially set in. So, um, what does need to be reported? What services need to be reported to MOTS? That's always a tricky one. If you need any data from MOTS, Justin King will tell you all about that. Are there any business changes, or if you have any business changes, Kayla will talk about that. She will talk about the MOTS refresher. It's a new thing we're going to introduce. And one of our standard items, of course, is switching from CE to EDI. And Jody Kramer is our specialist on that because she knows everything there is to know about EDI. And then, of course, we leave some room for more questions and answers. And we have a little slide with the new contact information because we changed things around a little bit. Okay, go ahead, Kayla. There you go. Those are our sweet smiling little faces. Let me start with Kayla, who is, of course, the MOTS system administrator, and you'll probably be all very aware that she has taken over and is definitely in charge. And she's also the Roads product owner. Roads, the new system that hopefully by the end of this year will be replacing the MOTS system. Second one is my picture looking over at the Oregon coast. And as you can see, it's nice and gray and cold because I have a coat and it's all zipped up. So I'm the senior systems analyst and I work a lot currently with the behavioral health data warehouse. That's a new thing that we are introducing to the organization, and we will be using it outside the organization as well. It's a big help to improve data knowledge and data research and communication with all our providers. The third one is Mary, and she is our mod support specialist. And a lot of you will definitely have worked with her to get a change in or get a password reset or get your email sorted out. Or if you have any questions, Mary is usually the person who's on the front line and working hard to help everybody that she can. And if she doesn't, she usually knows to find the right person to help you guys out. We go on from there to Jody, and she is, as I mentioned, our EDI technical expert and also the Roads product owner because it's kind of like a duo job. Kayla is the main one, and then Jody is the other main one, but more for the electronic data interchange part of the business because it's a kind of a different animal, and Jody specializes in that. The next one is Justin. He is our MOTS report specialist and a research analyst. And anybody who wants to know anything about anything, you ask Justin, even if it's not MOTS related, he can give you an answer too, because he's our Google specialist. So And then last on the list is Anna Melcher, and she's also the MOTS report specialist, and she's kind of taking over a little bit from Justin because Justin is moving into some different fields. So Anna will eventually be the MOTS specialist, and in the future, I assume the roads report specialist. And she's also a data analyst, and she can also answer all kinds of questions and does great research. And that, in a nutshell, is our team. And there's a lot more people around us that help us, but these are the main folks that we'd like to introduce, and we'd like to show you a face with the voice. Thanks, Kayla. Okay, why do we do these webinars? Well, first of all, I always enjoy it to kind of communicate with the people that we work with and the data that we exchange. So we definitely like to give you any information on any changes on any systems or systems coming or going, and if we make any enhancements and stuff like that. And as you all know, in the MOD system, we haven't changed much lately because of the new system coming up, but there's always things happening. There's legislative session is going on. So as we all know, that can make changes on the fly. So we love to discuss data issues. There's always data issues. There's good things, there's bad things, things we'd like to improve, and we have this platform to discuss them. As I mentioned earlier, you can jump in to get feedback, give your feedback on things that we're doing great or things that we could improve or things that we're doing horrible that you're struggling with all the time and it's been a pet peeve. Just let us know, and maybe we know there are certain things that we don't like either. So hopefully we're improving things, and with your feedback, we can make even more improvements. So. One of those things could be an idea for a future webinar topic to discuss on what the pros and cons are and why we're doing things, and explain how sometimes it's a little bit troublesome, but it kind of is the only current way that we have the things set up as we do. So, and of course, answer any questions you might have or have had over the past, and hopefully we can answer them. We have, besides our team that I just introduced, a few more specialists and people from our Compass team. And maybe we can pass those questions on and they can help you answer those questions. Okay, next one. Kayla. Is the news update still me?
I think it's still you, but I'm happy
Cool.
to do it if you want
No,
a break.
no, that's okay. I'm almost done. Okay, the behavior health data warehouse going live February 6th is still the date, although it might change, but next week. And then we have a behavior health data warehouse. It has that, and that's the big thing, and that's what we're all excited about, is a link between the Medicaid data and the MOTS data, the MMIS system and the MOTS system, because that was always a bit of a pet peeve for a lot of research units and reporting units, specifically health policy and analytics. They were trying to get all the data for the Oregon Health Authority, but the system setup was different between the two, and we managed to get them in a data warehouse, and we managed to get a primary client index built inside so that we know which clients are in Medicaid, MMIS, and in MOTS, and we can do a lot more reporting and get a lot better information. And this has definitely helping us a lot to get the 360 view that you might have heard people talk about of the clients that are in behavior health treatment. So hopefully by next week, so the next time we will have a webinar, which will be March 1st, we can tell you that yes, we are live, and anything you ever wanted to know about any of the clients, we have it all in the data warehouse, and it has a couple of more systems that we're working on. So. Okay, roads. Kayla will talk a lot more about that a little bit later. The administrative pause is still extended, and that has to do with the MOTS pause, of course. So it's a little awkward here. The sprint one is currently almost about to start because we have done a bunch of workshops with our vendor, Ernst and Young. You might hear the name here and there, and they are the contractor that are helping us to set up, build a new system. and we are doing workshops on user stories, what is called, basically its requirements and how the system we want it to look and how it should look and what it should do. And all those things are written up in what is called user stories on how to use the system. And also we're going to have more opportunities for you guys coming up, so you can engage in, like I said earlier, what things we're doing well, what things we could improve, and how we maybe can make everybody's life easier. And hopefully you guys will engage in that. Also, I mentioned the new email address for MOTS support. It is now all the ending in the Oregon.gov, ODHSOHA, Oregon DHSOHA, and Oregon DHSOHA.Oregon.gov for roads, and mods.support. And a lot of our users and our personal emails, work email, also has changed into the OHA.Oregon.gov. Yeah, and even if you still have the old one somewhere, it still will be rerouted to the new one, but you might have noticed that difference. So, okay, I think that's what I had. Go ahead, Kayla.
Thanks, Pete. So I didn't mean to make you do a slide marathon there in the
That's
beginning.
okay.
Also, I apologize that the administrative pause bullet should have been under a MOTS title there in the
Should have
last
been
slide,
here, right?
and that was my
Yep.
bad.
That's okay.
But yes, for all of our MOTS providers, that extension of reducing provider burden in the administrative pause is going to be extended. We're waiting to hear back about any updates to that, and we'll let you know as soon as we get an update. But for right now, just keep doing what you're doing. A couple of MOTS updates. I know I've sent this out in the MOTS Messenger as well, but I think it bears repeating. We do have new URLs, so if you have folks at your agency, or if you have bookmarks or favorites or whatever the youths are calling that these days on your computer, you might need to update those URLs because they are new and our old ones will not work anymore. Some of the information on our website has also changed. We've changed some buttons. I know that a number of people, myself included, got confused when you clicked training and it would take you to the webinar page, and people would join the webinars thinking it was a training, but these webinars are mainly geared to share information, new information, or information that is pertinent to people who are already using the system. And because we've had a number of new agencies and facilities register with MOTS, we've actually started a new Welcome to MOTS event that I'll talk about a little bit later in this presentation. As I mentioned it before, reporting to MOTS will continue as normal while the roads project is underway. And Jody and I, it is our primary responsibility to let you know when changes are going to happen. So don't worry, we will give everybody a hearty heads up when we know when that change is going to happen. As for the MOTS Messenger, it might look a little different. We sent it out last week, our February edition, preparing for this month. And we're now using a different platform, which is going to make it a lot easier for us to send information in a timely manner to people who request that information. So if you are not getting the MOTS Messenger, let me know. Feel free to email me or put it in this chat, and I can make sure that you get put on that list. I know that before we were sending it through Outlook, and so if folks didn't want it, they would have to reach out to us directly. But I'm pretty sure now with GovDelivery, you can unsubscribe. So if there's somebody at your organization that used to be in charge of MOTS work that no longer wants to see it or is no longer responsible for it, they'll now have the ability to opt out of those. But we never want that. We want everybody to know about MOTS. We also have a roads information form. This is going to do it. That's not what I wanted. I will have to put that in the chat in a couple minutes. But if you are not getting MOTS information, because that's not something you're getting, or if you would like to just be very sure that you're going to get roads information, we had a number of people reach out asking to make sure they received roads updates. So I created a mailing list to ensure that we have everyone on it. If you're receiving MOTS information like normal, you will be getting the roads information by default. And we're not going to send anything twice. Everything will, if you're on 2 lists, it's not a big deal. It'll only get sent to you 1 time. So I will put a link in the chat as soon as I get a chance, because this second view doesn't let me click into that box. And now I think Mary is going to walk us through what we do if we're having trouble getting logged in. Mary?
Okay, so we get a lot of requests for new users and also people that have had P numbers and maybe disabled or need to re-enable their P number. So my coworker Cecilia Lobby and myself, we work on those requests, and we just when we get word from our our Office of Information Services desk that the password or the P number has been created or your P number has been re-enabled, you get a email from them that says what your temporary password is. And you'll also get an email from us with instructions on what to do with your P number. So we send you an email with a P number and the instructions on how to create a new password and how to log into MOTS. Now, the password is created in a different uh, 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 browser or different address than the MOTS web portal, and it'll take you in the you'll put in your browser screen the address to set your password, and in it'll have one click. It'll take you to a black screen, and there it'll ask for your username or your P number and the temporary password that you received. So you put that in, and then you can then go and change your password. Um, And once you created your own password, you write it down, you just close out that browser and you'll need to wait for 15 to 20 minutes because it needs time that where you created the password, it needs time for that system to talk to the MOTS system. So and let it know that your password has been created. So then you'll go to the MOTS web portal after waiting, and then it'll ask again for your P number or username and for the password that you created. Now, there may, if for some reason your password doesn't take or it doesn't recognize you, just send us an email to Mont support because uh, we may have, there may have been a slight delay in Mott's getting that information. So we'll just reset your password and we'll tell you to try again. What happens if you try to put in your password too many times into MOTS, you'll get locked out. Not only, I believe, in MOTS, but you'll get locked out of the where you created your password, what we call the Active Directory. And so we'll have to tell you, I'm sorry, but you'll have to call the service desk again, contact them because they handle the passwords and resetting your Active Directory. But hopefully, if you're just patient, you'll be able to get into MOTS. So just also let your new users know that um, that they they need to follow the instructions, and it's very important to wait before they try logging into MOTS. So, and so Kayla, I'll just turn it back to you or to Pete.
Thank you, Mary.
Yeah.
Go ahead. There we go. Next on the agenda, what servers need to be reported to MOTS? Jody, microphone is yours.
All right, Pete, thank you. I want to make sure that I can get my mute button off. So good morning, everybody. Thank you for being here with us today. And so we wanted to kind of recap what services should be reported to MOTS. And when we're talking about services, these are going to be the individual services, like maybe they get a UI, you maybe do group counseling, you do equine therapy, you do different things for the client. And so those are what we call services, and those are submitted to us that for a client that you have put into MOTS. And so we're going to talk about which ones do you need to report and which ones do you not need to report. Typically, these services are what we call non-Medicaid services. So I'm going to start here at the top of this flow chart because it does get a little tricky sometimes. But we're going to start with the first question. Is the client Dewey or methadone? If it is yes, then you're going to submit to MOTS regardless of the payer. If it is no, then the next question would be, is the client substance use? And if it's yes, you would submit to MOTS. If no, then you wouldn't. Crisis or involuntary services, those also get sent to MOTS. Mental health treatment that's partially or fully funded by Medicaid, you submit the client to MOTS, but you send the actual billing to Medicaid. So I think, let me recap here. So essentially, for the services that should be reported, it's anything that's considered non-Medicaid. So your Medicaid services for your clients, whether they're CCO or OHP or private card or whatever they are, those you send the billing to the Medicaid system and the clearinghouse here, and you get reported that way. For anything that's publicly funded, that's going to be either from maybe you're contracted with the county to provide services on their behalf, you're contracted directly with OHA. Those services get reported to us for the client, so we know what has gone on during their episode of care. And on the first question that I started out with, Dewey or methadone, the reason that question was probably first is because per statute or rule, Dewey and or methadone clients, those are required to have the services supported to us regardless of what the payer is, if it's not already Medicaid. So do I have a secondary slide here, Pete, or is it did we condense it into one?
It's just
I
this
thought it
one,
was just
Jody.
one, yeah.
Okay. So so for the services, again, if it's partially or fully funded by Medicaid, you don't have to submit those services to us. But all the clients should be sent to us that fall within this category, because you have to let us know about your client, and it's the episode of care, the admission date, and the kind of particulars, the demographics, and different values, data points for your client. And once you provide those to us, then you have additional area for the client where you can add non-Medicaid services. So we have a hand up.
Yes, I saw Susie ask a question about what if the client is Suboxone medicated assisted treatment. Yes, that is considered a synthetic opiate, and in the text we have methadone, but officially the text is synthetic opiates. So if it is a synthetic opiate client, then they needed to be submitted to MOTS. That's the federal requirement. I hope that answers your question. I saw another one from Kim about weed to be a substance abuse. Weed can be part of a substance use disorder. It all depends on, it's not, doesn't matter if it's legal or not, because alcohol is also a legal substance, but it all depends if the substance inhibits the individual from having a normal or a regular life. So, and I think that's the main system. The substance doesn't really matter because there's so many different kinds of substances. So, and I think weed can be a substance, but is that in our list of substances? That's a good question that I'm just popping in my head, and I need to check that one. So why don't I give the microphone back to Kayla to go to the agenda, and we can see who, I think Justin is up, and I'll check the list of substances that we have in our system. There you go. Thank you,
All
guys.
right.
All right. Hi, everyone. So I'm Anna. Justin wasn't able to make it to the webinar this morning, so I'm going to take over his slide. But most of you likely get regular reports like the ones listed here from us, but you can also request any custom reports for other specific data that you might want to see from us. And so we're happy to help put that together for you. You can reach out to MOTS support to put in a data request, and we're happy to build those reports for you and answer any questions you have. Or if you think you should be getting any of these reports on the slide, definitely reach out. Back to you, Kayla.
Thanks, Anna.
Thanks, Anna. I just did a quick list, and there is marijuana hashies on the list. I think that can be, and there I know there's different kinds and stuff these days, but that would be sufficient for the weed substance use.
Great. Thanks for checking that, Pete.
Okay. Kayla, business changes. Up to you.
All right. Thanks. So this is just a reminder. We know that, businesses are changing all the time. Your agencies and facilities are experiencing changes. Just let us know is really the basis of this slide. If contacts are changing or if someone leaves your organization, those are just things that we would like to know so that we can update the MOTS contact information. If you have new folks, we can request access for them and get them a partner number. And if new folks are going to be responsible for MOTS, we can ask that you sign them up, or they can register for our Welcome to MOTS events that we are going to be holding. In addition, if your agency or if your agency is opening up a new facility, please let us know, because otherwise we will not know. And we can help set up that new facility in MOTS and make sure that the folks who are reporting to that new facility know how to do that. I know there has been some confusion on where that responsibility lies, but right now we don't get any updates about new facilities opening up. So if you know that one is opening, your agency is opening a new location, please let us know so we can assist in that process. And since I'm next, I'm just going to go for it here. And I can talk about our MOTS refresher. So this is a new series that the MOTS support team has decided to embark on, because we've had a number of new agencies and facilities register the last couple months. And it felt like it just made sense to make a recurring event so that anybody who is a little bit confused about MOTS or might need to see somebody walk through it once or twice to feel comfortable can have the opportunity to jump into this webinar, because we know that it's not just new agencies or facilities that might benefit from this. It's really anyone who maybe hasn't submitted to MOTS in a while, might need to just see the layout once or twice with us on the call so that we can answer questions if you need it. So this will happen the second Wednesday of every month. And it's really just designed to give everyone an opportunity to engage with the MOTS support team so that we can answer questions and folks can get some clarification about MOTS and our processes and how to do things. I want to just be clear that this Welcome to MOTS event is not this webinar, and I'm doing my best to make sure that those things are explicitly different, because in the Welcome to MOTS event, we'll be doing essentially the same thing every month. We will be walking folks through the system, how to submit different types of data, and how to log in, and simple things like that. So if you're comfortable with that already, and that's something that you are doing today and have been doing for a while, there is no pressure to attend one of these. But if you're a provider and some of your staff might need a little training, it's definitely going to be an event that they're going to want to register for. So I will also put that in the chat. I'm also putting links to all of these events, webinars, and the Welcome to MOTS event in the MOTS Messenger newsletter that gets sent out. So if you can't get it here or in this chat after we're done, it will be in that document or in that newsletter that got sent out last week. But I'll try to figure out if I can do that while I'm presenting here. The plan I had for how to do that, it did not work. So that's my mistake. And I appreciate everyone's patience while I learn what I can and cannot do as a presenter on this platform.
You'll figure it out, Kayla.
Okay, thank you.
And you have a little time, because Jody's spiel of switching from CE to EDI is coming up. So go ahead, Jody.
All right. Awesome. Oh, there's my slide. There we go. So yeah, everybody, for those of you who may be considering moving from entering through the web portal for MOTS to electronic data, a couple things that we found for folks that have been switching over the years that has been super helpful. We've kind of written them down, and we wanted to just highlight them. This might be very similar for some and new for others. So first thing you want to do if you are looking to switch systems is to our ways of submitting data is to let us know that you're thinking about it or when you think you might be doing it. That will actually help us to make sure that we have enough people and time and everything lined up for you. If you are looking at an electronic health record system that you don't have, or maybe one that you're looking to get upgraded to the newest platform, then what we recommend is a few things to kind of ask about the MOTS functionality. There's a lot of different ways that the different systems work, and the process and the flow. There's no one way that's right versus wrong. It's just different. And so depending on your organization, it's just helpful to know kind of how that works. So ask, maybe ask to see what is the actual process from the time your client walks in till the time you actually submit the data, either from your system directly or you submit the file to us. This will help you determine how much staff time is still going to be required and who's going to do what. There's often this myth that if you go to electronic data that it doesn't take any, that it's all automated, right? And that isn't necessarily always the case. There's always some people that have to work in on that. So knowing that in advance is always good for laying things out, meeting your expectations. Again, no one way is better than another. There's just differences. So knowing that, once you get all that figured out, decide which one you're doing, you've told us, then we're going to ask you about the timing of your project. Are you fast tracking it in 30 days? Are you doing 6 months? Is it a year out? Maybe you're on a 3 to 5 year window. And that's great too. Even just saying, hey, we're thinking about it, we will, once you say, yep, we're going to be doing this, we figure out your timing, but then we have a few other steps that we go over. One of them is going to be the process for actually stopping your client entry submissions into MOTS and moving over to the EDI. There's a location that we set up on our servers here for you to put your files in for processing, or your system will do it. That's called the Secure File Transfer Protocol setup. If you have been EDI before and you move to client entry and you're going maybe back to EDI, you've got a new system, we will double check and see if you still have one established from before and if it's still usable. The thing that we find too that takes a little bit of time is your client ID considerations. If you are moving to an electronic health record system, oftentimes there is a system generated number for your clients, and that is usually what we see come through with your file submissions. If that's the case, then we just make sure that we update and change the client IDs to match what your new system will be. Defining your business processes is super important, ties up there with functionality. We are going to test the files from you and your system individually. So even if you pick out a system, say for example, Ocean, Epic, CareLogic, Dr. Cloud, there's a number of them that have many providers. If you go with those, that's great, but we will still test the files for certification purposes at your level. And this is really done because there's so many customizations and different domain setups and depending on if you're cloud hosted or how it works, that your setup might not be identical to others that use their system. So we just want to make sure that all of the setup and mapping works just as well when it comes in before we get live files and then realize that we have a problem. Once you're certified, we're going to go live. That just means you're going to be sending live files instead of certification files to MOTS for processing. And we're going to do some follow-up work sessions or workshops, connects, whatever you want to call them, so that we can answer any additional questions that you might have once you're actually in the process of doing this real time. Meaning, not real time like every second, but, on your standard interval that you've chosen to submit files, we want to be able to be available to answer any questions you might have or things like that. They can last as long or as little as you need and at the interval frequency that works best for your organization. And we've been doing this quite a while, and so we've got a pretty well laid path for it. And as well as we migrate into roads, a lot of these things are going to be very similar to keep in mind and to think about. So with that, again, thank you all for being here. And I'm going to turn it back over to Pete.
Thank you, Jody. And thank you, Kayla. She put the links in the chat. She kind of filled it up and had some little comments about it. So for the welcome to MOTS or the information about the road system. So they're all in there. So click on the chat button and it opens it up, and then you can kind of copy and paste it and save it on your browser somewhere. Okay, questions and answers. Last time we had a first for the Teams webinar, and Kayla managed to get a recording and get it out on our website. And I have not heard that it didn't work. So we are going to get a recording of this in case you missed it, or some of your coworkers might think it'd be helpful because you can have the information about the links and the new stuff coming up. Or if you would like to share it, you can always refer to it or review something that you're not really sure of. Especially the one with the arrows and who to report is always a very popular one, and one that people like to check and make sure how was that again? Because there's always different situations. People are just, it always feels a little different, and it's nice to have that flow chart to kind of sort out if you guys should report or not. So if you're really in doubt, just report them anyway, because you're already reporting so many people. So one more or one less is not going to make that much difference. So, and you can always send a question to the MOTS support email, of course. So, okay, recording there. The MOTS Messenger is also, if you missed one and you didn't get it, it'll be on our website. Our next EDI focused webinar, because today was CE, of course, client entry, will be, as I mentioned, March 1st. And I don't see any hands raised or any questions popping up. Did I miss anything, guys? Just checking with the team.
No, I think you got it.
Excellent.
I think in this last slide, I put our the new domain email. So if you're using our old email, it'll forward you on to these ones, but this will be our new domain with the oha.org and .gov there.
Excellent. For the website and our email support. And next time. Okay.
We do have one question.
The website for
Okay.
MOTS. Mine no longer works.
I can
And
put
it's
that
that
in the
one.
chat right now.
It's on the slide there.
Actually, I think that one is the
Or
old
is that-
one now that I'm looking at it.
Oh,
That was
ah,
got past me. Kim, I just put the new link or URL in this chat, so you have
right.
it, and I will update this slide.
HSD. Yeah. Okay. Anything else? Okay, well, thank you all very much and have a wonderful rest of your day.
Thanks, Pete.
Bye.
Thanks all. Bye, everyone.
Bye-bye.